Dr. Dina Peterson of Noble Clinical Research is joining us. Doctor, great to have you back.
Thank you.
So what do you do and your staff do at Noble Clinical?
We conduct FDA-approved research studies testing new medicines to make sure that they're safe and effective.
And I mean, there's so many out there. People might be asking themselves, do we really need new medicines?
Great question. In 20 years as a family doctor, I've learned that not all medicines work for all people, and oftentimes more than one medicine is needed to treat a problem. But with the right combination of treatments, people really can feel better and live longer.
So let's talk about the specific. What type of medicines do you study there?
We study medicines for a lot of different indications, a lot of different medical problems. We nearly always have a study for knee pain from osteoarthritis, and in fact we have 3 of those going on right now studying different medicines. We have a very exciting study right now for eczema. Eczema is a skin condition where it's red and very itchy, sometimes so itchy that people have trouble sleeping at night. And the standard treatment is to apply a steroid cream or ointment all over the rash 3 times a day. One of the things that's terrific about this new medicine is that it's a pill that's taken once a day and can settle down all of the inflamed skin. So that looks really terrific. When people have eczema, sometimes they just have a little bit. It may be inside of their elbows, around their neck. But this study is looking for people who have a fair amount of eczema, at least 10% of their body.
And then it kind of takes over the way that you live in a way. People get very self-conscious about it. You think about what you're going to wear or how do you hide something. I mean, I think we've all seen those commercials about what people go through.
That's an excellent observation. Yes, people really can feel embarrassed if it covers an area that is going to be seen with certain clothing and so on. We have another study for insomnia. Trouble falling asleep or staying asleep, of course. And this study is really terrific in that people who volunteer for this study, who screen for this study, get to have a sleep study, an overnight sleep study. This is a very expensive test that many insurance companies do not want to pay for. So even if they don't qualify for the study, they often derive benefit from the testing. For example, just a week ago, we had a man who did not qualify for the study because the sleep study shows that he doesn't have insomnia, but rather he has severe sleep apnea, which is a very dangerous condition, and his insurance company was not willing to pay for a sleep study. So through our trial, he was able to get one, and now he can move on to treatment with his doctor.
Yeah, clearly a number of benefits for somebody to get involved in.
For sure.
So what should they expect when they call and are pre-screened for this, et cetera? What does a volunteer process look like?